brain stroke or brain attack occurs when blood supply of brain is interrupted. When blood supply of brain is interrupted, the brain cells or neuron, they begin to die and part of brain is damaged. Our brain control all bodily functions, and the damaged brain, if it controls any particular function of the body, that function is lost, and this is known as brain stroke. If this occurs in brain, we call it as brain stroke or brain attack. If it occurs in heart, we call it as heart attack. Majorly, there are two types of brain stroke. One is ischemic stroke, the other one is hemorrhagic stroke. Ischemic stroke occurs when blood supply of the brain is interrupted because of the clot. It occurs in roughly 85% of the cases. And hemorrhagic stroke is because of the rupture of the artery, which occurs in roughly 15% of the cases. These are two main causes of brain stroke. Apart from this, there are some minor causes which lead on to stroke. So in this discussion, we'll talk about only these two causes of stroke. There are multiple risk factors for brain stroke. These risk factors can be broadly divided into two categories. One is modifiable risk factors and other one is non-modifiable risk factors. And in modifiable risk factor also, we can divide them broadly into two categories. The one which can be modified by patient, and the other one which can be modified by medical intervention. If we talk about modifiable risk factors, the various risk factors are physical inactivity, unhealthy diet, lack of exercise, and smoking, alcohol. All these are risk factors which can be controlled by patient. And there are a number of other risk factors like hypertension, diabetes, high cholesterol level, then the underlying heart problem. If rhythm of the heart is abnormal, this can also lead on to stroke. And there is a condition called obstructive sleep apnea. This can also cause stroke. So these are various medical conditions which require medical intervention for control of chances of stroke. As I explained to you, brain controls all bodily functions. So when part of brain is damaged, the bodily function controlled by brain is lost. So this could be in the form of facial droop, arm weakness, leg weakness, slurring of speech. All these could be the symptoms of stroke. Besides this, there could be blurring of vision, giddiness, balance problem, loss of consciousness and headache. And it becomes very difficult to remember all these signs and symptoms of stroke. So we have a mnemonic to remember all signs and symptoms of stroke. This mnemonic is FAST, wherein F stands for facial droop, A for arm droop, and S for speech, and T is time. If all these symptoms are within 4.5 hours, then this patient requires immediate intervention, and with immediate intervention, these symptoms can be reversed. So it's very important to identify these symptoms, and if you want to include more symptoms into it, you can remember B FAST, wherein B stands for balance, E for eye symptoms. Eye symptom could be in the form of blurring of vision in one eye or both eyes, and FAST remains the same as I discussed earlier. So for ischemic stroke, if we give clot dissolving treatment, then this treatment can be given in initial few hours only, first 4.5 hours. If patient receives treatment, timely treatment, then this clot dissolves and blood supply of the brain is restored, and we can save brain cells or neurons from dying, and this can prevent the disability and death. As I told you that when stroke strikes, there is interruption of the blood supply of the brain, and when blood supply of the brain is interrupted, every minute 1.9 million neurons die. So if we give the clot dissolving treatment early, the loss of neurons can be prevented, and if we contain the damaged brain area, that will result in reduced disability and death. So this treatment, if we provide it within 4.5 hours, this 4.5 hours period is known as window period, And when patient arrives to hospital, most of the patients, they come late in the window period when already 2 hours or 3 hours are over. And once patient arrives in hospital, we have to immediately work up these patients within 1 hour, and this 1 hour period is known as golden hour. In a way, you can call the entire period as golden period or golden hour, because time is very important in management of brain stroke. And we always say that time is brain, because if you save time, you save brain and you save disability and death.